All right. Hi, everyone. Thank you for joining us. This is our spring URI College of Pharmacy alumni student panel. We have a great group of alumni, pharmacists, and current URI College of Pharmacy students who are presenting tonight. I want to thank the current students who are joining us, and also it looks like we have a few of our admitted students, some of our prospective students who may be joining us in the fall. Or in future years. I see a few names here I recognize, so thank you for joining. My name is Erica Estes. I am a clinical professor in College of Pharmacy, and I'm the director of recruitment. If anyone has joined and is not part of our panel, I'm just going to ask you to keep your camera or your audio muted, and if you can keep your camera off, unless you want to be on our recording, because it's recorded and your image will be included with the square, which we'd love to have you, but you may or may not want to be on that. So at the end, there'll be time for questions, and feel free at any time during the panel just to type a question in the chat, and we'll be able to answer that. We have several students who are on who can answer those questions. I'll be on as well, and you always can unmute and ask those questions at the end as well. All right, so with that, I'm going to turn it over to our host, Jennifer Palmies, who will introduce herself and our amazing panelists. So thank you.
Thank you. So hi, everyone. My name is Jennifer Palmies. I am a P3 student at the University of Rhode Island College of Pharmacy, and I also serve as the current president of our Student Society of Health System Pharmacists organization. So joining us today, we have Julie Barber, who's a pharmacist from Westerly Hospital, alongside Jacob Derby, who is also a P3 student with experience at South County Hospital. We have Caitlin Kennedy from Brown Health alongside Alex Bose, who's a P4 student who has worked in this similar setting. And then we also have Kayla Kwan, who works at CVS, alongside Sydney Federico, who is a P3 student who works at an independent pharmacy, Seaside Westerly. So to begin, I'll just give them, I'll just hand it over to them so they can introduce themselves a little more and talk more about their role as a pharmacist or in the student setting. So whoever, feel free to go first.
I'll go. I'm Kayla Kwan. I'm a pharmacy manager at CVS in North Kingstown on Quaker Lane. I've been a pharmacy manager with CVS for 16 years, and I've been a preceptor for 15 now. So I really appreciate the opportunity, and I love what I do. I love teaching students. That's probably my biggest passion at CVS.
I can go next. My name's Jacob Derby. I'm from West Greenwich, Rhode Island. As Jen said, I currently work as a pharmacy intern at South County Hospital, so I've gained a good amount of hospital experience there. I've been there since the summer before my P1 year, so about 3 years now. And I also work at Brown Medicine in an ambulatory care setting, so if anyone has questions about that too.
I can go. My name is Julie Barber. I'm a clinical pharmacist at the Westerly Hospital here in Rhode Island. So we're a small community hospital, and it's kind of nice. I get to rotate through a lot of areas, staffing in either critical care. We have an outpatient anticoagulation clinic, but my preference is really to staff in our inpatient pharmacy doing central operations.
And I can go next. My name is Caitlin Kennedy. I'm the Director of Population Health Management for Brown Health Medical Group Primary Care. As I like to jokingly say, it's the artist formerly known as Coastal Medical. So in my position, I oversee a few different teams, but I would say it's pharmacy and pharmacy adjacent. So we have a team of clinical pharmacists who do collaborative disease management in primary care, as well as pharmacists embedded in some of our population health disease management programs. So that includes diabetes, hypertension, heart failure, and COPD. And those are multidisciplinary teams that have nurses, nurse care managers, and care navigators who are mostly medical assistants by background. And then I would say more recently, I've also stepped into a little bit of the clinical operations space, and I'm now overseeing our call center as well as our document management team.
All right, I can go next. Hi, everyone. My name is Alex. I'm a current P4 student at URI. I work at Brown Health Medical Group Primary Care as well as Kaylin. She's my, I think, second supervisor of. So I have a little bit of a different role than her as a student. I complete comprehensive medication reviews and speak to patients there about their different medications. and things of the sort, which we can talk about in a little bit. And I've been in this role for just about a year now. Additionally, I also do work at CVS Pharmacy as an intern. I've been there for just over 6 years.
And I would say in true Rhode Island pharmacy fashion, one of the pharmacists on our team was also Alex. Alex is supervising pharmacist at CVS before she joined our team, because it's such a small world.
Then I think that's me next. I'm Sydney. I'm a current P3. I'm from Westerly, Rhode Island. The last 2 summers I spent working at Seaside Pharmacy in Westerly, which is a small independent community pharmacy. And here at URI, I'm also on the track and field team.
Great. So for one of our first questions, kind of just walking through, if you guys can walk us through a day in your life and talk about some of the responsibilities that you have on a day-to-day basis.
I can start. I think many of you are familiar with community pharmacy. For those of you that work in community pharmacy, as the pharmacy manager, I have to make sure staffing is appropriate. I collaborate with our front store team to make sure we're cross-training people from front store into pharmacy. I oversee our immunizations and driving those goals to make sure that we're helping our community meet the needs. So we have different prompts at the register and things to help us engage our patients in conversations around vaccines. I have a handful of interns, so my role is also to mentor my interns to prepare them to someday be pharmacists, potentially for CVS. I also precept URI students, so students that need to do their IPI community hours. I take them every summer and kind of show them everything else. Our team at CVS, we work as a district with all 20 of our stores to kind of manage our workload now. So it's really nice in community. I know in the past it was very stressful, but we're entering a stage where our workload and our work-life balance as pharmacists is a lot more positive, which is exciting to say. And it's only improving with the technology that's coming. So part of my role as pharmacy manager is also making sure that I'm conveying any changes that are occurring and coming down the line, making sure my team is learning all of these rapidly changing technologies and getting excited for the future, because it's one thing after another, which is exciting with community. Nothing's ever the same.
I can go. So if I am staffing in the central pharmacy, it's a little bit of everything. You're checking IVs, you're checking the fills for, we recently changed from Omnicell to Pyxis. So we're still learning a lot about that, but checking the medications that are going to be filled to the Pyxis machines. We verify orders for a lot of the outpatient areas in central pharmacy. So it's like the OR, infusion therapy, the endoscopy unit. And so a lot of just sort of problem solving, which I like. So a lot of issues will come up throughout the day, and you have to quickly kind of figure out what's the problem, how we're going to fix it quickly, because there's a patient waiting to get that medication. So how to decide like what's the safest and most efficient way to deal with it. So that's probably the part of my day I like the most, is like problem solving. And another role that I work in is our outpatient anticoagulation clinic. So there we see patients on warfarin or Coumadin. And it's a really nice structure. They come in, we stick their finger, which I always find funny because I feel like I wanted to be a pharmacist because I wanted to work in healthcare, but I didn't like people's blood. And now I'm sticking people's finger all day. But we stick their finger, we get their INR, we complete an interview of what might have changed or what might have any side effects they might have. And we give them dosing and the calendar and follow up and send them out the door. So we kind of handle everything on one visit. So it's really nice for the patients and it's nice for us. And then even though they're just there for their anticoagulation, I feel like it's a time where they get one-on-one time with a pharmacist or a pharmacy student. We have our students down there as well. They ask a lot of other questions, and you're able to help them kind of manage any other thing going on in their day that they might not have anyone to help them with. So I like that type of patient contact as well.
And I would say I feel like at this point in my career, and also in my position, I fall on the opposite end, and I don't necessarily feel like a real pharmacist most days, because I am on more of the operational side and the administrative side. So one of the things that I do get to do is develop clinical protocols like Julie was just talking about, that they use in her clinic, right, for anticoagulation management. So a couple of years ago when we rolled out our program, again, it's in primary care, so we do a little bit of everything, but developing those protocols and everything else was things that I do. One of the things that I feel like lately absorbs most of my day is really thinking about the primary care crisis that we are in the state right now, and how we can leverage our different care teams. And I would say, in particular, pharmacists, because I think they are uniquely leveraged within the primary care space to help bridge some of those gaps, especially in between visits. Because if you're a primary care clinician who has a panel of 2,000 patients, there's no way you're seeing them, every year, or definitely not every 6 months, and most of the time not every year. So how can we leverage the other clinicians on the teams and really work them to the highest level of their licensure to make sure that our patients are taken care of? So I would say our diabetes program in particular, it's one of our most robust and well-developed population health management programs. We're taking care of those highest risk patients with diabetes, and it's full care. We might be doing the med adjustments on their insulin or their GLP-1s, especially at this point. I think almost everybody in the program is probably on a GLP-1 or a GIP. And they're also talking to that patient who then might be saying, okay, you just got me this new prescription, but I can't afford it. And now what do I do? And help connecting them to different resources within the community or even within our network to help them. So while I may not get to do that direct patient care, I've got amazing teams that do. So I know that they're in good hands.
I can follow up from Caitlin's answer. So I also work at Brown Health Medical Group Primary Care. So I work in a role where I'm completing comprehensive medication reviews. So what my day usually looks like is that I will go in and I have a list of patients that I kind of will routinely go through, and I'll work them up. So basically, my workup consists of going through the electronic medical record and seeing all the different medications I can find that this patient's taking. I go through insurance claims to see claims of what medications the patient has filled in a community pharmacy. I do some deep diving into trying to find anything on their file, and then I do a drug interaction check, make sure everything makes sense, make sure everything has an indication on their file. Just kind of thinking clinically about all the different medications, and sometimes there'll be different medications that you think, I don't know exactly why this is here, or maybe this shouldn't be taken together, things to that effect. So once I kind of do my workup and I look at all their medications and I screen for any issues, I'll give the patient a call, and I kind of do a motivational interview call with them and talk to them about all the different medications they're taking. I have them tell me exactly how they take everything. Throughout the call, I usually end up giving a lot of different counseling points for all the different medications. On the call, also recommend vaccines that the patient would be eligible for based off of work I do in my pre-work before I call them, and just let them know of anything that potentially could have flagged or come up. And usually it's kind of just like making sure everything's clean on their medical record and making sure everything is in line for all the different clinicians that collaborate to make sure that they all know what's going on. But sometimes you do catch some pretty big errors in patients, and make a good correction. So it feels really good to be the one to maybe make a good catch sometimes. But it's a really great experience that I've been able to speak to patients a lot, which I love, and it's been really good clinical experience. And then any issues that we potentially find, I'll contact the prescriber along with the pharmacist I'm working with, and we'll look to get those amended on the patient's record.
Yeah, so working at South County Hospital is definitely a little bit of a different setting than what Alex was going over in ambulatory care. So, similar to what Julie said, on a regular day in the hospital pharmacy, mostly just doing like day-to-day operations, like delivering medications across the hospital to like the different Spixis machines on different floors. Another big thing that we do at South County is sterile IV compounding. So all of our interns get trained in compounding, and that's another big thing that we do throughout the day. Um, One cool thing about South County is that being a small community hospital, you do get a lot of opportunities and as an intern to play a bigger role. So I know my director allowed me to get involved with some administrative tasks. I know one example, we did a medication use evaluation on remdesivir in COVID patients, and we ended up allowing updating our guidelines to be a little bit more up to date and saving the hospital a little bit of money along the way. I've also been involved in like some policy and procedure development there, things like training our new technicians and interns. We also did a policy on safe handling of hazardous drugs in the hospital. So I've also been able to get a lot of administrative experience there. But outside of that, it's mostly those day-to-day tasks. When you get into your P3 year, they will sometimes let you start to work on medication reconciliation. So I know that's different at some hospitals. Some hospitals allow interns and technicians to do it. Others don't, but at South County, they do allow us to do it when we get into our P3 year. So that basically involves going up to the patient's room for new admissions and interviewing them, similar to what Alex said, going over their medication list, making sure we have an accurate record of what they're taking for their admission. So that's kind of what a day looks like for me at the hospital.
Sorry if you hear vacuuming in the back. I'm in the library and I guess it's cleaning time, but I'll try to be loud over it. So in the summer when I work at Seaside, it's a community setting and it's really nice because it's like Westerly is a smaller town, but we do get patients from somewhere like Richmond, Ashaway, even Connecticut, even sometimes like around like school, like people like from the Kingston area come down to Seaside. And I think one of the most important parts about being a pharmacist in a community setting is the relationship you make, being able to see the familiar faces come in again. You are able to bond and be able to see your fellow community members. And they really do trust you because in a community pharmacy, you are very accessible to them, more accessible than their doctors even sometimes. So it's really nice to be able to kind of like use that clinical knowledge, but in a community setting and like explain to them like how the drugs work, counsel them, side effects, and just honestly answer any of their questions. Besides the interpersonal interactions, community pharmacists, they fill prescriptions. We immunize too at Seaside, which is exciting, and talk to insurance companies. Yeah, I really love the interpersonal aspect of it. It really is never a dull moment. So
Thank you guys. It's really interesting to hear about the different roles that pharmacy students and pharmacists can have and how even pharmacy students are collaborating with pharmacists on a daily basis during their jobs. So very well. I do have a question from one of the members, so I'll have you guys answer them first. But they said, for any panelists, how did you decide what you wanted to specialize in or where you wanted to work?
I am the one oddball. I have wanted to work for CVS since I was 5. My aunt lived with me when she was at URI going to school, and so I kind of just followed in her footsteps. I did as a senior, I did my senior project at CVS with her to make sure it was actually a good fit because I had said it all along, and I loved it. I love working with people in the community. And I feel like as a community pharmacist, we can touch so many lives. And it can be a really powerful thing. So I, went to URI and then became CVS pharmacist, and I've never looked back. We've had some tough years, but I've weathered them successfully because I'm so passionate about what I do. So.
So I actually I worked at Westerly Hospital as an intern in college. And then when I graduated, I went and I worked at Fatima Hospital in North Providence. But I had such a great experience working there as a student. And I am from Westerly locally. So when the opportunity kind of came up to come back, I jumped at it just because it's such a nice place to work. And I kind of don't have a specialty. I do a little bit of everything at my job, and I think I like that the most. There's been opportunities to go into oncology or go into other areas, and I kind of am really happy where I'm at, getting to do a little bit of everything. So sometimes it's nice to like have an opportunity to pass up, a specialty that's not exciting to you or it's not your passion, and kind of stick with what you're enjoying right now. So hope that answers your question.
I would say I had a very different experience. I've had a very circuitous path to get to where I am. When I was at URI, I was convinced that, yep, I wanted to pursue residency. I was going to do PGY1, PGY2, specialize in psychiatry. Ideally, wanted to get into the VA system, be able to practice there. And I would say that that trajectory and that path was thrown for a little bit of a loop when I was in school. I unexpectedly lost my father when I was in pharmacy school. So as I got closer to graduation, I said, if I did pursue residency, I could end up really theoretically anywhere in the country. And at that point, I said, I'd like to stay closer to home and closer to my mom. So I took a job with CVS after I graduated, and I would say, and I'm sure Kayla is very familiar with this, but I was promoted pretty quickly to become a pharmacy manager, and I was a pharmacy manager there just a little bit over a year. At that point, I was just starting to think this isn't necessarily the practice that I wanted to have. I had previously worked for an independent pharmacy that had done a lot with the community and a lot of community involvement, including doing diabetes education. And I said, that's really more where my passion is and where I'd like to get. So an opportunity came up at Coastal Medical in an ambulatory setting where I would still be a manager, because also as a manager, I realized really kind of liked it, and I was actually pretty good at it. So I was able to do that. And then, a few years into my practice there, I had said, okay, no, compared to some colleagues, I don't have that same clinical background because I hadn't pursued a residency, and I wanted to be able to find a way that would distinguish myself from there. So I actually went back to school and did a master's in health administration. So staying along that administrative path, and so definitely there now. And as I had mentioned earlier, even starting to step away a little bit more from the clinical side into more of an operations piece. So who knows where the next 10 years are going to take me, because I was just reflecting, I'll be 10 years out now from URI. So excited to see what, as I said, the next 10 years brings.
Okay, I have another question from the chat. Specifically Alex and Jacob, do you have any tips for how to get a job in ambulatory care as an intern? I'm very interested and have been on the lookout for jobs.
Yeah, so I think kind of what Caitlin said about the right time, the right place. I feel like I kind of got started at Brown Health Medical Group Primary Care, the same kind of situation. It was kind of just the right time, the right place, everything aligned. I was really interested in AmCare from my P2 year on. And so I knew I was very busy with a lot of different commitments, and I always in my head knew I wanted to try some kind of AmCare job. And I was like, if something would work out that I could just get right at the end of my P3 year, like that would be so great. And I'd actually heard about Coastal, and or what used to be Coastal, I guess. And I wanted to try to actually apply there. And like Caitlin had said, my old preceptor at CVS was a pharmacist there now at the time. So in the beginning of my P3 year, she asked me if I wanted to apply for a position there, but I was just so busy at the time with school and other commitments. So luckily, like right as the end of my P3 year approached, there was a posting on, I can't remember where, maybe Indeed or something like that. I was checking like everything like that constantly for an AmCare opportunity, and I ended up kind of just stumbling across it, and I applied. So it was kind of right place, right time. Everything kind of worked out kind of perfectly. I know there's not tons and tons of AmCare opportunities around, so definitely keeping up to date, checking everything, and maybe reaching out to pharmacists in those fields if you have any connections for sure.
Yeah, similar to like Alex said, I think it really just comes down to putting yourself out there. I know for me specifically, I applied to one ambulatory care position I think it was my P2 year, in a diabetes clinic, and I didn't end up getting that job. There was like a few of P3s who had applied who they ended up hiring instead. But just by getting out in that interview and meeting people, my name got around, and when a position opened up with Brown Medicine in a different facility, my name came up and they offered me an interview. and the interview led to me getting the job. So I would definitely just say putting yourself out there, even if you don't get one, it can lead to other opportunities. And then like Alex said, looking at all those websites like Indeed. I know for me personally, like Dr. Ferret will always send out, Dr. Ferret, one of the professors at the college, will always send out job opportunities on Core Elms, like our professional development site. So definitely just being on the lookout and putting yourself out there as much as possible.
Great, thank you guys. So another question, what experiences and opportunities have shaped your journey to get to where you are now? And then for students, what experience and opportunities have shaped your journey through pharmacy school, and how do they influence your career path or where you might end up?
I can go. So I would say, like interning when I was in pharmacy school at Westerly Hospital, like helped to cement that I knew I wanted to work in a hospital. And then talking about kind of my path to how I got here, similar to what Caitlin was saying, like it's not always what you think it's going to be. So I had planned also to do a residency after graduation, and I didn't match, which again, like then you sort of feel like, oh my gosh, what am I going to do? And I had also been involved with SSHP when I was in college. And so when I didn't match, I actually reached out to a pharmacist, sort of like wasn't involved with school or residencies, and just said like, I didn't match and I don't know what to do next. And she actually said like, oh, that's funny. We have a job at Fatima Hospital we think you'd be great for. So having the experience is great, but also like the connections you make along the way really do help you, because I had worked with this pharmacist on projects with RASHP, over 4 years. So I feel like I had cemented a really good professional relationship with her. And then it helped, like, I never thought that's what I was going to be doing after graduation. And it really helped to get the ball rolling with my inpatient pharmacy career.
As far as CVS and being a pharmacy manager, my supervisor every year always asks, what do you want? Do you want higher volume? Do you want to move up to be a district leader? And in my first few years early on, I learned I love teaching. That is my passion. And so over the years, I've made that very vocal to my bosses. And I now train incoming pharmacists for CVS. So they'll go through a training program, and then I give them their like a clinical training at the site. And I also have all my students that work for me. I have out-of-state students as well that go to the college, and then the IPPY students. And we just started doing a collaboration with South Kingstown High School. So we're actually taking South Kingstown High School students as externship, and they're coming a couple days a week, and I get to train them as well. So I teach them about OTCs and pharmacy drugs and the whole process. They get to learn about all the different steps to how a prescription gets handled, and they can shadow us as we give consults and DURs. So I love the teaching aspect of my job. Because I'm so passionate about the patient care, I think it's nice. It makes me feel good when I can impart that wisdom and passion to others. So that's been an exciting journey in my career, even though I've kind of stayed in the same thing.
I think for me, one of the biggest things, and even just thinking about it right now and kind of reflecting on it, honestly, my first pharmacy job, I started because I had done an internship my senior year of high school, and it was at an independent pharmacy for some people that are from Rhode Island, they might remember, but it was Oxnard Pharmacy in Warwick, Rhode Island, which is also where I'm from. And then the owner at the time offered me a job after I graduated, and I stayed there as the pharmacy technician and then an intern until he retired and sold the store and sold the pharmacy. But so Dave Feeney was the owner at the time, and he was such an innovator for pharmacy practice, particularly community practice. As I mentioned, he had partnered up with the city of Warwick to do disease education, and I feel like that was like a big thing to be doing and offering these free resources in the community. In addition to that, I think Oxnard was the first independent pharmacy in the state to initiate electronic dispensing as well as a robot. There are smaller, chain stores that don't even have robots, but this independent pharmacist was able to implement electronic dispensing like that. So I never, I was always encouraged to, think ahead and think outside of the box. And I think Dave really set that in motion for me. And then I also want to piggyback off of something that Julie said. It's about the relationships that you make, especially if you stay in the state of Rhode Island. Rhode Island is a very, very small state. And pharmacy is even smaller in Rhode Island. So you never know like what connection that you have that's gonna really kind of make the difference for you. When I got my job at Coastal, there's a practice manager that I knew personally that I was even able to reach out to say, hey, I applied for this. If you know the hiring manager, like any chance you can put in a good word for me. And she said, obviously I can't say anything about what you're like as a pharmacist. I have no idea, but I can at least say what you're like as a person. And I think her recommendation also probably helped at least get my foot in the door. So like I said, you never know who's going to be able to help you along the way.
Yeah, so I think I spoke about it a little bit with my answer to the previous question, but I think definitely just getting a lot of different experiences helped me kind of decide where I wanted to go and got me to this position. I think now I worked at CVS for a while and I did really like a lot of aspects of that position, and I still do, which is why I hold both of my jobs. I just couldn't pick, I guess. But I just really like talking to people and helping people. So I knew that something in either community or AmCare was for me. And I think once we had heard from an AmCare pharmacist at a panel similar to this for one of the other pharmacy organizations at URI, I really had my eyes opened to ambulatory care, and I knew that was what I was definitely interested in. And on my appies, I had my AmCare block first, and absolutely loved it. And I was actually at my AmCare appy one day when I got my offer from Coastal, so it was really exciting. But I think definitely all the different experiences, and especially appy year, trying everything out in pharmacy, really got me to see what I was interested in.
I agree with what Alex said. I didn't have much pharmacy experience before going into like my P1, P2 year. For our first like IPI we had to do, like our shorter internship, I was actually placed at Seaside. Did it there, loved it, got hired afterwards for the remainder of the summer. And then last summer I was at Westerly Hospital. I saw Julie a few days there, and Julie's actually going to be my preceptor for one of my appy rotations. So I'm really excited for that. But yeah, just going along, just keeping an open mind, saying yes to opportunities that may interest you. Because I feel like as a student, you're not going to really know what your like true passion is until you're actually like in it, hands-on experience. Because you might think you like something until you go and you like spend your whole like college career thinking you're gonna want to do something, but then you get there and you're like, oh wait a second, like what is this? So I feel like just like trying everything and just networking, like we said, super important. And yeah.
Yeah, I really agree with what Sydney said that you have to try stuff in order to understand it. Like for me personally, I always thought that I was going to be interested in clinical work after graduation, but after working at South County and getting a lot of those opportunities to administrative work, it definitely made me more interested in administration and leadership. It motivated me to apply for the dual MBA program, so I'm a couple classes away from finishing the MBA too. And that's something I never thought I would have been interested in when I was initially going into pharmacy school. So I would definitely say, like Sydney said, just trying everything. You never really know what it's like until you get there. Um, and you always have time in pharmacy school. We all have held a bunch of different positions, so you have time to go around and try things.
Thank you guys. That was great. So one of our next questions for the pharmacist, what did you wish you knew while in pharmacy school? And then for the students, what's one thing that you've learned in pharmacy school so far that's helped you to progress in the profession, or just some advice that you would give to some incoming students?
I think I wish I had known that uh, it was really important, like work-life balance. It's hard when you're a student because there's so much going on and you're trying to work and you're trying to gain experience as I was. But then I also had to focus so much on school, and it's important to keep that time for yourself as well. And I feel like there were definitely some years in the beginning of pharmacy school that I did not take enough time for myself. I think I finally figured it out my last 2 years that I needed to have an outlet. And I think that's so important as a student and in life, to have time for yourself every day, do what you love. I mean, I'm super passionate about pharmacy, but I also have other passions. Like I have a horse and I make sure I have time to ride every week. So I think having that is really important to balance the stresses that come with work and school.
I totally agree with you, Kayla. And I think that's also something like I still work on in my career. Like, you know, things ebb and flow, but it's so important to like sometimes say no just to prioritize like yourself in your life. I know that's not really the question, but yeah, I love the point that you made, and it's like something that I'm still always working on.
Gonna switch gears a little bit because I would say I totally agree with all of that, especially that it's okay to say no to things, as somebody who has a hard time doing that. But um, one of the things that I wish I had done more as a student was get involved at a local level. I was involved in a lot of different pharmacy organizations, but and I'm going to make a plug for folks that might be on the call. And I think I saw David on the call as well, who is an intern or a student with us on RIPA. But being involved in advocacy for the profession, I think it's really important for us to start to get students interested, because you come out and there's all these things going on, and there's huge important things that might change your life. And if you're not involved, you might not know that. Like, for instance, last week there were at least 5 different bills in front of the House that were going up to be reviewed, that all related to pharmacy. And I'd say, how many of you knew that? And if you didn't know that, maybe that's the plug to, like I said, get involved on a local level in some advocacy for the profession.
I think one thing that I think is really valuable is just realizing that we are lifelong learners and that there's always something more to know. No one knows everything. I think, being in pharmacy, everyone is like so smart. I feel like I've always kind of had like an imposter syndrome to a degree. Like I know a lot, but then when you're working with all different pharmacists and different specialties, everyone just seems to always just like know so many things about like their thing. So I think realizing that we're always going to be learning, you're never going to know everything, is kind of just something you have to come to terms with. And I think that's something that's been really great for me, is that I know a lot of things, but there's always more to learn. I'm actually on my inpatient rotation right now, on my appies, and it was so funny because I'm with a really great pharmacist who works in the inpatient setting, very clinically, and she was asking me some questions about different cardio medications, and I was answering them, and she was like, oh man, like I feel like I know absolutely nothing. Like sitting next to you, I just feel like you just know so many things. And it's so funny because I felt the exact opposite way, that I was sitting next to her as she was doing all her different things for inpatient patients, and I was just thinking the exact opposite, like, oh man, I feel like I don't know anything, and she knows everything. So we all have our different specialties and everyone collaborates, and that's our whole point. So I think that's one really good thing to just always remember.
Yeah, I mean, might sound like a broken record here because I know people have touched on it, but I think like networking is your biggest strength. So especially for like the students who are incoming or maybe in some of the lower classes, just putting yourself out there in like professional organizations, and like Caitlin said, with even like local events and organizations, the more people you meet, and the more connections you have, the more opportunities you'll be able to get. Like I know even Dr. Estes in the call right now would love to help point you guys in the direction of like many opportunities. Faculty is a great place to start, so reach out to a faculty member in an area of interest of yours and see if there's any opportunities you can get involved with. And I would just say try as much as possible, like we have continued to emphasize.
And to go along with that, Jacob, after you graduate, stay connected, right? Like there's a reason that we're all here today, or the 3 of us, all of us, the whole 3 of us, but there's a reason we're here, right? And it's because we do stay connected to the college as well. And they're at the forefront of everything. They know what's going on. So it's also I think it's really important to maintain some roots there.
Just to piggyback off that, I feel like I learn so much from my students every year too. Like it is nice to constantly have interaction with students, because you guys are so smart and you're learning newer things. And, I'm doing my CEs and I read my pharmacy magazines and I try and stay up to date, but I learn from my students every day just as much as they learn from me. So it's wonderful to have that connection. I agree.
I'll keep it like short just because I think my fellow panelists put it perfectly. I really like the networking is huge because at the end of the day, like, yeah, like you're in school for like 6 years here and you get those grades for 6 years, but then after those 6 years, you just have like your people. You don't have your like grades really or like stuff to rely on. Like the people that you meet can take you farther than anything else. So it's always good to stay in touch, have good relations, and also yeah, being super passionate about something else. I like I said earlier, I run track and field here, and it's nice to just like break up the day a little bit. I think it reduces burnout in the long run if you have something else you're super passionate for. It's just nice to balance, and I learn a lot about myself as a student through like what I learned in track. I can't really learn in pharmacy and vice versa. Like I learn a lot on the track that um, from myself as a pharmacy student. So
Thank you. I think that was very well said, all of you. So going into one of my favorite questions, why did you all choose URI?
I already said I did it because my aunt worked for CVS, went to URI, and I'm from Rhode Island. I'm from Warwick. I live in West Greenwich. I didn't go far, and so. And to be fair, URI has a fantastic reputation. So even I applied to somewhere in like Pennsylvania, and they were like, "Why are you here? You're from Rhode Island." I was like, "Well, just in case I don't get in, I have to have backups." But yeah, URI is one of the best in this side of the country, so we're lucky.
I would say it is similar. Oh, you can go ahead, Julie.
I was gonna say, I'll give sort of the opposite view, and I can admit, so I'm from Westerly, so it's, the house that I grew up is like 20 minutes away from URI. And I really wanted to go somewhere else. I wanted to leave the state. I felt like there's sort of sometimes there can be like a connotation of staying and going to URI. So I really wanted to go somewhere else and made the decision to go to URI more like for financial reasons. And like looking back at it now would have been so stupid to go anywhere else, paid so much more money to get like not as good of an education because we do precept from other schools at my site. And like I can say it's such a huge difference clinically and professionally than you see for URI students compared to other students. And then I really did, once I got to URI and realized like how wrong I was for not wanting to go there, had the best experience. And before everyone else got on the call, I was talking to Dr. Estes about how a bunch of us just went to our 10-year reunion in 2023. And there's still this big group of friends that I stay in touch with on a daily basis. And then a larger group of friends from the college that it was just so lovely to see. So I can admit that like I wanted to go somewhere else and I couldn't imagine have gone anywhere else. Like I just had the best experience at URI. It's a really great education and really great people.
So another Rhode Islander, born and bred. So URI was pretty much always in the forefront. Really, no matter what I chose to study. But as soon as I narrowed it down into pharmacy, because I knew it was going to be healthcare somewhere along the lines, URI was pretty much it for me. And I'd say it didn't hurt that one of my dad's best friends is a professor in the College of Pharmacy. So I'd say he did a whole lot of talking up the school for me. And I mean, as I think Julie really nailed it. I don't think you can get a better pharmacy education anywhere. It's wonderful, and when I think about the professors that are there and their wealth of knowledge, and they're at the cutting edge, and I just I don't know. Again, like I can't imagine getting that somewhere else, and I definitely see other students. In fact, I even work with students from Brown that are either in the medical program or trying to get into medical school. And the difference is pretty striking sometimes. And I will take the URI pharmacy students 10 times out of 10.
Yeah, I can go next. So I think I also am from Rhode Island, but so when I was looking at pharmacy schools and I decided I wanted to do pharmacy, where I was like #1 on my list, I looked at other places as well, but I toured URI like at least 4 times. Loved URI. So once I got in, I had the luxury of that really easy decision, and I like have absolutely been so happy with my decision. I was a tour guide here, an orientation leader here. I like love URI. So great pharmacy school, and I'm so glad I got to come to URI. So we've already talked about what a great program it is, so I'm not going to repeat it all, but yeah.
Yeah, again, for me, a lot of the same sentiments. I'm from Rhode Island. I had three brothers, well, one brother and two stepbrothers who had gone through URI already and talked about how, close-knit of a community is like everything else in Rhode Island. Everybody knows everybody, which you can use to your advantage in a lot of ways. And I just always felt at home at URI. And again, like as everybody has said, I heard so much about how good the pharmacy program was here that it was kind of a no-brainer for me.
So, shocker, I'm also from Rhode Island and very similar to Julie, from Westerly, 20 minutes away from school. And I like growing up, being in high school, everybody would be like, oh, like I don't want to go far, like I don't want to go close to home and everything. But I feel like if the answer is so like obvious, like for me, like I want to do something healthcare related, you are like everybody has said has a great program. And I would kind of be silly to just not do that. And it's also not as close to home as you like make it out to be. Like it's only as much of your home as you want it to be. Like you don't have to go back home only when you want to, and you can make a ton of new friends. Like sometimes I honestly forget that I'm even from Rhode Island because I have friends everywhere. I have friends from like Hawaii who come here, like Ohio. I have girls on my track team from South Africa and Israel, and like I've met so many people, and my world has expanded so much in a place that's so close to my home. So it's really great. It's just like the best of both worlds.
I know I'm the moderator, but I can also add to that. Just because I'm not from Rhode Island, I'm actually from New Jersey, and I didn't want to go far at all, but it was very hard to pass up URI. Out of all the pharmacy schools that I toured, I just had to go to URI. And so even though I didn't want to go far away, I was drawn to URI, even though I'm from New Jersey. So it's just a great program overall. But we do have a question for Jacob. So can you talk about your experience in the PharmD MBA program?
Yeah, absolutely. So, like I said earlier, it's really my experiences in administration at South County Hospital that drew me towards the MBA. I had attended some panels similar to this where former PharmD MBA graduates talked about their roles and some things that they were able to do with their MBAs. There was, always a question in my mind of whether or not I would be able to balance the two, like the PharmD and the MBA classes. They are night classes. They can be during the summer sometimes, so it seemed like a lot at first. But you can definitely set it up in a good way where you can balance, when your busy pharmacy schedule might be, maybe you take some easier MBA classes. And then outside of that, it's just a really good change of pace. Outside of the fact that I was interested in administration and management, I was also kind of just curious about the topic, and it's really nice to be able to go there and learn about something outside of pharmacy and kind of break up the pharmacy program a little bit. And I do see a lot of relation between my MBA and what I see in pharmacy on a day-to-day basis. So both in the hospital and at Brown Medicine, working in administration and management, there's so many things that you can take from the MBA program and apply to a real world scenario for sure.
Thank you, Jacob. So maybe one of our last questions, just because we have just a few minutes left, but I know we talked about it already, but reiterating, what do you love about your job, and do you ever see yourself changing areas of pharmacy?
I get asked this a lot because I've always been gung-ho CVS, but I just love it. I don't think I could leave because the longer I stay, the stronger my patient connections are. And I'm that face that they see on a weekly basis sometimes or a monthly basis. If they're in the middle of the night and something happens, the next morning, we're their first call because they can't reach their doctor right away and we're open. So it's such a valuable uh, interaction to have with patients that I just love it. So it would be really hard to get me to leave. I do think that Caitlin's position, not so much admin, but just that role of AmCare and working at Coastal Medical, that's so intriguing to me. And having that patient care, I think I would thrive and I would love it. But I just think with community, because I'm passionate about it, there's a lot of community pharmacists that have gotten burnt out and don't love it anymore. So I feel like I have to be the one to keep going and be that face that is happy to go to work every day at CVS. And for my students as well. So I think it'd be hard to get me to leave, but who knows?
Similarly, I love that my job can be something different every single day. I really like the opportunity to do different roles and take on extra projects. And I also, it would be hard to make me leave as well. I'm from Westerly, so it's really nice to feel like you're serving your community. And also I joke, like I have a less than 10-minute commute. It's really hard to beat that, especially in the summer. Like I could be at the beach at 3:15 p.m. But yeah, I do love my job and I love the people I work with. I think that's really important as well, to have good coworkers that can really make or break your day. And I'm very lucky to have really great coworkers.
Yeah, my teams are definitely the favorite part of my job. Not just, I would say not just the pharmacy and the clinical teams that I have under me, but also my fellow directors. On the clinical side, there's a couple of others. So there's about three of us. I'd say we kind of grew up together at Coastal, and we've all been kind of promoted along a similar trajectory. And what's really great now is that we have managers underneath us that are starting to form that same camaraderie and that same bond. And it's amazing to see them take over our programs. I say that in quotes, like I'm super possessive over it, but to take our programs and then really make them their own and see where they can take them and grow them and make them so much better. One of my favorite parts about my job, and that you can't tell, is mentoring. Like I love being able to work with other clinicians, other managers and students and things like that, and to help people grow. It's also I would say, very fast paced. Healthcare is, and I kind of mentioned this earlier about talking about the primary care crisis. I think we're really coming up to a critical juncture nationally, but also really locally here in the state as well. And I'm really proud to be a part of a group that's working to be the solution, and to make sure that we're maintaining access to patients and really, really high quality care. So I don't know, it'd be hard pressed to leave that, but
Yeah, so I could take it from there. I love my position as well. I think what I do love most about my position with Brown Health is working very clinically and very much with patients as well. And that's just what I've, I think, always been interested in since I kind of figured out exactly what ambulatory care was. I remember way back earlier on, I just thought you were like on an ambulance. I really had no idea. So I think like I really needed my eyes opened. And since they've been opened, I've been like, oh, this is great. I'm definitely going to be pursuing a career in ambulatory care. I'm doing an ambulatory care based residency program next year at Dartmouth Health. So that's a very exciting way to kind of continue and expand my career in ambulatory care and kind of, I guess, get it started too. And I'm also staying with CVS per diem because I just love that position as well. I just couldn't give it up. So yeah, I still can't change anything. I still won't get rid of either of my jobs, but yeah.
Yeah, I would say, like people have mentioned already, the biggest thing I love about my job at South County is the people. I think that was one of the first things that I noticed when I started working there. I was so lucky that that was my first experience because everybody was so accepting. And as the pharmacist here pointed out, so willing to be mentors and kind of guide you along the way, not only in the pharmacy program, but also professionally outside of it. So it's really just the people. Outside of that, I do see myself working in a hospital in the future. That could always change because I have a lot more time in appies and outside of that to experience different aspects of pharmacy. But I am definitely interested in staying in a hospital, an institutional setting.
Like what Jacob was saying, I the people I feel like make the place, and it's something to like make you like wake up every day and you get excited to go to work because the great people can go a long way. Um, I'm looking forward to all my appy rotations and really getting some hands-on experience. And like I said before, keeping an open mind, not ruling anything out except for maybe something research related because I like people too much. So I feel like I need that aspect of it moving forward.
Awesome. We have one more question in the chat. For any of the panelists, how do you deal with burnout and stress at work or stress due to pharmacy school?
For burnout at work, I can say that just be open about it. Like a good manager will always be willing to take something off your plate or work with you if you voice that you're burnt out or you don't have the bandwidth to do things. So because everybody, it happens to everybody. Like I can admit, like I went into my career being like, oh, I'll never get burnt out. I can do everything, and you can't. So just being open and honest about it. Your coworkers or your manager, if you have good coworkers and managers, will like always be willing to help you out.
Yeah, the coworkers I think sometimes are the ones that can really help you there. I'd say mine are the ones that let me know when I'm starting to get a little bit crispy, and they'll pull me aside and say, "When's the last time you took a day off? Let's look at your calendar and make sure that you are." So, taking that time and to recognize the symptoms in yourself to say like, okay, I need to take a step back and I might need to do that. And I know Kayla said earlier, right? Like finding the things that you are passionate about outside of work. So like for me, I know I always feel my best if I'm able to move my body physically. So whether that's sometimes it's even taking a walk around the block with my dogs or my daughter, although that takes a little bit longer because she wants to stop and pick up every rock that she sees. But right, just like even if it's like 10, 15 minutes just to do something to like move helps.
And I think too with CVS, I mean, for years, like during COVID, we hit rock bottom and it was really difficult. But now we're in such a better place. I force myself to take my 30-minute break. I actually leave my computer most days. Um, when I need to eat, I eat. When I need to go to the bathroom, I go to the bathroom. If I'm having a stressful day or a difficult interaction with a patient, I'll go in the back and do a quick like breath exercise to calm me down. I think breathing meditation is super important in my life now. And I learned that from COVID and from nearly becoming burnt out. So I think that can be pretty helpful as well.
Yeah, I'll add from a student's perspective. I know this was mentioned before, but knowing when to say no. Um, you can find yourself, especially when you're trying to taste a lot, taking on too many responsibilities. So I think if you set bigger priorities and goals for yourself on what you really want to focus on and what important to you, and kind of making sure that if something doesn't align with those things, you can say no. So not taking on too much.
Yeah, just to kind of echo that, I think I'm kind of like on the edge of like I will be entering the workforce, but still have that student in me too. So I think just not overwhelming yourself and not taking too much onto your plate is really important. I always liked my plate loaded pretty high, but I always made sure to like not completely overload myself and always just like everyone else was saying, realizing what's important for you. For me, I just know I need a couple hours before I go to bed at the end of the night to always, even on my busiest days, kind of just decompress. Talk to coworkers or things if you're feeling burnt out or tired in the workplace or things are going on, feeling comfortable with your manager, things like that, I think have been really important through and through.
Okay, so I don't see any more questions in the chat and we're coming up on 8 o'clock. So I just want to say thank you to all of our current URI students and future URI students for coming to the panel tonight. And a special thank you to our panelists for volunteering and taking the time out of their busy work schedule to provide some insight into their roles and why they love URI so much. So thank you guys so much and have a great night.